we need to have an eye to the future and understand the incredible power that modern technology holds in terms of helping us meet these changes. And we are very privileged in the NHS to have Professor Bob Wachter of the University of California, San Francisco, possibly the most IT advanced hospital in the world, who is helping us understand what we need to do in the NHS. And Bob is the first person who will say that technology should never be an end in itself. It's a means to higher quality, safer, more efficient care. But he's also uncovering the paradoxes that we have in the UK when it comes to technology. The paradox that we have some of the most advanced electronic records anywhere in the world in our GP network, and yet we have a number of hospitals that still have brown paper files at the end of every patient's bed. We are the country that is in the race to be the first to decode 100,000 genomes, and yet the NHS is reputed to be the biggest purchaser of fax machines in the world. We do nearly a third of all clinical trials in Europe, in the UK, and yet we read stories of patients not able to access the latest drugs regularly in the papers. And what Bob is going to help us to do, and he'll be presenting his final report at Expo in September, is he's going to help us to understand how we lift our top dozen or so hospitals that have the best IT systems to world-class levels of performance, where we are still not at, but then how we take the others who aspire to being world-class and get them into a position where they can have that as a realistic and credible explanation. And I don't want to steal his thunder, but I think he's going to say that clinical leadership of IT transformation programs is absolutely vital if we are going to make that a success. So that is why we have to be relentless in our determination to achieve a paperless NHS, one of the more bold promises that I made in 2012, but something that I'm absolutely committed to achieving, because modern technology is going to be crucial in helping us square that circle between access, finance and quality, which we all know is important.